Much. Well, as we continue to sort through the maze, and that's just that's putting it mildly, that is healthcare reform. Craig Gussin, our insurance expert, is back here with us this morning, talking about some of the top things that you really have to know as you start to select a plan. Now, before we get into that quickly, I was reading down here that they're going to require now that for those of us that have insurance through our company, if the company is of a certain size, we're going to have to report on our W-2, we're going to have to report our insurance as a benefit. They're going to have to assign a monetary value to that.
Right.
What does that mean? Are they going to start taxing us on our insurance plan?
If you're a large group and they have so many W-2s in a year, I think it's 250, they're going to take the amount of money that your employer contributes towards your health insurance and they're going to put it, I think, in box 12 of your W-2. Now, it isn't taxable income, but they just want to get a look at how much money the employers are contributing towards your health insurance.
They're setting us up to tax our insurance because now all the information's there, and the next step is they say, oh, you're getting a benefit that other people aren't getting, so you need to pay tax on it. So now your insurance is going to go up even more because you're going to be taxed on it. You think it can happen?
If you go back 4 or 5 years ago, it was a big issue in the presidential election when during the election.
Don't remember which candidate.
Right, I don't remember the candidate, but one of them said it, and it was a major thing for a couple of weeks. I don't think they will. I just think that it would be, in my opinion, it wouldn't be a good thing for them to do because most people, it's one of the few benefits they get without being taxed on it. So I don't expect it, but when you really need money, who knows what they're going to do down the road.
Right. Okay, well, that's just something to keep your eyes on, folks. Just one more way to get in your pocket and make your health care costs go up. Okay, let's talk about some services that are going to be offered and what you need to kind of keep an eye on as if you have to pick a plan out of this exchange, what should you be looking at?
Well, what's going to happen as of January is that every plan is going to have 10 essential benefits. Very basic stuff that we need to know about. Everybody's going to have hospitalization coverage. Everybody's going to have maternity coverage. Now, I know most people think, well, that's pretty obvious, but it isn't. There are plans out there even today where you think you have good health insurance, but it only covers you if you're hospitalized like $1,000 a day for 3 days. And then all of a sudden you get this big bill and you can't figure out why you owe this money, and it's because the plan you have isn't really a catastrophic or a comprehensive health insurance bill.
Now, you used my knee surgery when I blew out my knee and had my ACL replaced and some other things fixed in my knee. You used that as an example. I was outpatient, and it might have only covered $1,000 of that, and I'm home recovering, and here comes the mailman with my big fat bill that I thought I was covered for that kind of surgery.
And what happened after you had your surgery? They did physical therapy.
Of course.
That wasn't covered. Now, there were some basic plans. I used to sell a plan that one of the major companies had. It was a hospital-only plan, but it was $50 a month, and people loved it. But they understood there was no prescription benefit, no benefits, just if I'm hospitalized.
Right.
That is all changing, and that's a good thing because now people know that the health insurance they're going to get is going to really cover the most important things. You're going to have prescription coverage. Generics pretty much going to be covered. Brand names, you really want to look and see what, if your prescription is on the list that they use.
So you're going to have to do some homework to pick these plans.
Yes.
Now, we only got like 15 seconds here, but one of the things I wanted to mention was dental and dental checkups. The kids are going to be covered now. You're going to be required to have a plan that covers your kids?
Yes.
Required?
Yes, and most of it's going to be built into your medical plan, but if it isn't, you're going to have to buy a dental plan to cover kids up to age 19.
Or what, get fined?
I don't know what they're going to do. I haven't that part. I haven't heard, except they're going to do it. It's going to give you 2 free dental hygiene checkups. Along with that, you're going to have vision care for kids, and it's going to cover, an eye exam once a year, which is a good thing because that does help.
But to be required to do it.
I agree with you. And it's, again, a lot of it's still coming out. Every day I'm getting new information. It's going to be a wait and see. Because again, we're 3 months away from being able to even sign up and 6 months away from getting a new health plan. So there's still a lot of things that we don't have answers to.
Okay, well, Craig Gussin is here to continue to bring us answers as they come in. You're the first guy to get them. Yeah. A lot of doctors and dentists, say, well, that's news to me when you start talking to them about this stuff.
Exactly.
So, okay, well, you keep it right here on Wake Up San Diego, and you'll hear it first. Thanks, Craig, as always. All right, for some